para makita agad ng mga customer. Pwede nyo rin ipagmalaki na certified safe kayo sa inyong mga social media pages. Paalala lamang, ang isang safety seal ay para sa isang branch lang. Siguraduhin bawat branch mo ay certified safe. Siguraduhin din na nasusunod palagi ang minimum public health standards dahil baka mabawi ang iyong certification. Maaring mag-operate kahit na walang safety seal. Pero hindi ba mas mahalagang kampante ang mga customer sa loob ng iyong negosyo? Kaya kumuha na ng safety seal para ingat-angat tayong lahat.
Now, to formally introduce our esteemed guests for today, here with us are Undersecretary Ireneo Vismonte of the DTI Management Services Group to discuss the implementation and accomplishments of the Safety Seal program in the micro, small, and medium enterprises. Next up is the Assistant Secretary of the Department of Labor and Employment, Maria Teresita Cucueco, to talk about the implementation and accomplishments of the Safety Seal program in the workplaces. And not last but not the least is Dr. Nika Howe of the Department of Health Disease Prevention and Control Bureau to discuss the ensuring safety in the workplace. So without further ado, let me welcome Undersecretary Ireneo Vismonte of the DTI. Good morning po, Yusek.
Magandang umaga. Thank you, Ms. Tejada. And a good morning to everyone here. Asik Tess, magandang umaga po, Dr. Nika. And the DOH organizers of this activity, to our friends, our partners from media. Magandang umaga po sa inyong lahat. I think our opening video explains already our safety seal program. And for this portion, I was asked to report on the DTI's implementation and accomplishment of the safety seal program. Bago ako mag-report, gusto ko muna magpaliwanag. Ano ba ang safety seal? Ano? So this is a voluntary program that would recommend na yung mga establishment po natin ay sumusunod sa minimum public health standards and protocol. Ang ibig sabihin po nito, yung mga customers, mga papasok sa establishment na ito, whether it's small or whether yung mga individual or standalone establishment or commercial establishment, or even yung pong ating mga government offices, mga manufacturing, factories, etc., ay sumusunod po sa mga minimum health protocol. And what is suggest is, safe dito sa loob, pumasok kayo. Parang ganyan po yung ibig sabihin ng safety seal. No? Pag meron tayong nakitang itong marker or yung post outside the establishment, kadalasan po niyan isang sticker na merong size na A4, pero pwede naman mas malaki. Ang nakalagay po ron ay itong ating safety seal. Ito po ay it builds consumer confidence. Alam naman po natin, as long as you follow the suggested maximum operating capacity, whether it's 30%, 40%, yun po ibig sabihin na sumusunod sila sa minimum health protocol o yung public health standard doon sa establishment na yun. So ito pong customer confidence na ito naman ay magli-lead sa business confidence. So sumatotal po nito, consumer, business ay magkakaroon ng confidence muli para po talaga ma-promote yung ating muling pagbubukas ng ating mga establishment. On our side, we made sure that our regional and provincial officers are engaged in the inspection of establishment. Talaga po meron kami mga system na we put in place at para po ma-monitor po yung compliance. Even before the safety seal, ay meron na rin kaming inspection na ginagawa to ensure na talagang binabantayan po natin ito pong mga establishment na sumusunod nga po sila sa mga health protocol. Kasama po natin ng DOLE, headed by ASECTES, sa pagkaroon ng mga inspection, particularly dun sa mga indoor, yung pong mga ventilation standards. So far, we have inspected 4,000 DTI po, 4,224 establishment, and we have approved 3,169 so far out of the total 5,210 application. So as of this writing, ito po mga partner agencies po natin, kasi kasama po natin sila rito, aside other than DTI, DILG, DOLE, DOH, and LGUs have approved a total of, and the Department of Tourism, a total of 21,676 safety seal applications. So, ang ibig sabihin po niyan, ang DTI, meron po tayong 3,169 na na-approve. Ang Department of Tourism, meron pong, I think, 780. Ang Department of Labor, meron pong 251. At ang DILG po, sila po yung nag-i-inspect ng mga government buildings and offices, 4,578. At ito pong mga LGU natin ay nakapag-approve na po ng 12,898. But my understanding is itong LGU, ito pong report na to ay limited lamang po sa Metro Manila NCR. So of course, ito pong ginagawa natin ito ay hindi po mangyayari if not we have that strong commitment of our local government units, or our LCEs or mayors, upang ipatupad po ito o ipalaganap itong programa ng Safety Seal. Mahalaga po itong partnership natin with local government units dahil sila po talaga yung gumagalaw sa baba upang mabantayan din natin yung commitment naman ng mga establishments na sumunod dito po sa ating mga pinapatupad na minimum health protocol na kaakibat o kasama nitong program ng ating Safety Seal. Lastly, we want to highlight the importance of PDITR on top of our vaccination effort. Kasi ito po talaga yung particular program na kailangan po nating bantayan. Kahit na po anong klaseng quarantine meron tayo, ito pong PDITR talaga po ay kailangan nasa isip po nating lahat. Kasi ito po ay information na dapat nasa bawat isa sa atin upang masundan po talaga natin yung pagpapatupad ng pag-iingat, pag-detect, pag-isolate, pag-treat at pag-reintegrate po ng ating mga mamamayan against COVID. So, of course, more than boosting the consumer confidence, ito pong Safety Seal program ay gusto rin po nating ma-engage ang government and private sector para po talagang ma-own nila o ma-commit nila yung kanilang mga establishment para po sa implementation and enforcement ng minimum health protocol para po talaga ma-prevent ang transmission ng COVID-19. Yan lamang po at magandang umaga po sa ating lahat.
Thank you so much po, Yusek Vismonte. So for the next resource person naman po, we'd like to welcome Assistant Secretary Teresita Cueco of the Department of Labor and Employment. Good morning po.
Good morning, Ms. Ferina and Yusek Boy. Thank you sa presentation mo at ang gagawin na lang po namin dahil nagbigay na nga ni Yusek Boy ang detalye at importansya ng Safety Seal, update na lang po kami para nalalaman nyo kung ano na po yung mga nagawa ng DOLE. Can I share my screen po? This is very short. Yan, you can see yan. Sige po, you have it. Yes, thank you. So this is from the DOLE. Next slide, please. Now from the DOLE, we already, next slide po. Yan. We have issued 261 safety seals, but we understand we have received 853 applications nationwide from 693 establishments and 261 po ang na-issuehan ang nangyayari po dyan, may 294 na deny. Kasi usually, pag denied right away, may isang kakulangan, importanteng kakulangan tulad ng contact tracing, digital contact tracing apps, nakikita po namin agad yon na kailangan talaga sundan because that is really part of the safety seal requirement. That is really where most of it would come in, and others would really also be on the checklist of the DOLE, kaya na-deny po. Then 20 of these that have applied were found not to be within the DOLE jurisdiction. Sabi nga ni Yusek Boy, maraming ibang mga ahensya ng gobyerno ang nag-i-issue ng safety seal. And minsan baka nalilito lang na pupunta sa DOLE, ang dapat nasa DOT kasi hotel siya o restaurant sa loob ng hotel. O dapat nasa DTI kasi barbershop siya pero binigay pa rin sa DOLE. And 33 were not eligible due to lacking requirements. Now, on the eligibility for safety seal, even if you have issued 261, meron na hong pending, ito yung 27, that is ready for inspection. Na may schedule na po, gagawin na lang po yung, and 216 actually is pending for inspection. Yung pending for issuance, na-inspect na po siya, pasensya po ha, nalito lang ako ng, yung pending for issuance, na-inspect na po siya, ibibigay na lang po yung safety seal marker for the establishments. For pending for inspection, we have 269. So these are now nationwide in all regions and inspections will follow. Next slide, please. Ito na po yung bilang sa buong Pilipinas, sa mga regions, on the applications, the issuance, and those that are pending for the issuance, yung mga na-deny, and those that need to be inspected. We can share this naman po with you, but this is really a running total po every week. Hinihingi ho ng aming focal dito ang DTI na mag-report sa kanila every Friday. And this is of the latest that we have reported to them noong August 23. Next slide, please. And ito po yung breakdown. We have 184 manufacturing establishments provided the safety seal, 21 construction sites, 43 for utilities, 8 for warehouses, and 5 for information and communication companies. If you go to the BWC website of the DOLE, nandun this is a requirement for us, yung mga regulatory authorities, the list of all establishments issued safety seal. You can check po from each region, sino-sino itong mga kumpanya na na-issuehan. Next slide, please. And these are examples na po. And you will see the companies mentioned here. Like for manufacturing for food, we have issued for McKinney. For manufacturing for the products that we know of, Unilever has also been issued the safety seal. Next slide, please. For construction, we have issued for FESCO the bridge project in Quirino and the Sistec lighting and controls in Antipolo Rizal. Next, please. For utilities, we have also issued for Quirino Electric Cooperative and for Prime Water Infrastructure Corporation for utilities in Zamboanga. Next, please. For warehouses, nandyan ho yung DNF Distribution and Logistics in Isabela and Entrego Express Corporation in Lapos, Iloilo. Next po. For IEC, examples lang po ito, the Calibo Cable TV in Aklan, 9 Media Corporation in the NCR. Next, please. Okay, so that's it po. Those were just examples. The whole list you can find in the DOLE BWC website. I encourage you to go there. Nandun din ho lahat, pati checklist. Ito yung mga ni-require ng safety seal sa aming regulatory agencies para madali ang pag-apply. Nandun po, i-click nyo lang, pati checklist kung mag-assess na sila. And if they still need further assistance and guidance, even the hotlines that they would need to call for both complaints and assistance are also there. So, yan po from the DOLE. Again, we continue to do our role and our work for the safety seal, especially because this is really the way of telling the consumers telling the public, telling our own workers that if you enter into a place where there is a safety seal compliant po siya, USEC Boy has always stressed the PDITR, and that is really the best strategy. Of course, we know there is vaccination there, but the PDITR and there is a cornerstone strategy in protecting ourselves and everyone. So thank you very much, Prof. Nadole.
Thank you very much po, Ase Kukweko. For the next presenter, let me welcome Dr. Nika Hao of the DPCB. Good morning po, Dr. Nika.
Good morning, Farina. And I want to thank USEC Boy and ASIC Test for giving the overview of our work already on the safety seal. So what I will be discussing in actually just a few slides, and if the team can flash already, is the framework for which the safety seal is founded on. No? So I think lahat naman tayo naririnig palagi yung PDITR. And just to recap, if you can go to the next slide, this actually means all of our strategies to prevent, to detect, to isolate, to treat, and to reintegrate. So the DOH will be releasing in the next couple of days some reminders on what are all of the specific actions that can be done across all of these strategies. But actually, if an establishment will have that safety seal, it's really that certification that they're actually doing all of the things that are being recommended. So I will not go po into the details of the PDITR strategy, but what I want to share na lang po in one slide are some of our reminders po to establishments and to the workplaces on what are all of these high-yield actions that we should actually be doing to make sure that we have safe operations both at the workplace and also for our customers. Sige, next slide. So these 10 reminders are summarized po in this slide. So first is that as much as possible, we should be promoting the work from home arrangement. No? So of course, with allowing work to resume, it's still prudent upon the employers to make sure na those na hindi naman talaga kailangan to be on site will be minimized as possible, especially for workers who are senior citizens or those with a comorbidity. For those naman that will be at work, we have to make sure that they have all of the mechanisms to implement the minimum public health standards. Yung isa sa pinaka-important talaga dito is as much as possible, we have hand washing stations available, and to also implement those reminders that they should be implementing these standards at the workplaces. Especially those who are at work, we should always make sure that they wear the face mask and the face shield as appropriate, especially when they're indoors, and especially for the workers who are at direct contact with more people or are more exposed. As an interim guidance, we recommend that they use medical grade na masks, kasi they are more at risk as compared to everyone else. So number 4, and this is something that is constantly reminded of everyone, the importance of improving ventilation. So we can improve ventilation using natural methods, so opening the windows, having fans, or making sure na hindi crowded. But if really necessary, then we recommend investing in retrofitting specific spaces to make sure na they are in compliance with the ventilation standards that are recommended by DOLE. Number 5, what we found is that it's the social gatherings that is usually the reason for transmitting the virus, So ito yung mga nagkakakumpul-kumpul sa isang kwarto, and most likely yung mga times na kumakain at naghaharapan sa isa't isa. So as much as possible, employers are encouraged to urge all of their employees that they avoid all of these gatherings and that they avoid employees eating together or even sharing the items. And if there are employees that do report to have symptoms, it is very important to immediately isolate test, and even send home po, no, these employees to make sure that there's no transmission in the workplace. And to make sure po na alam ng lahat ng employees ano ang kailangan gawin, they have to have all of this important information at hand, no, and disseminated para they already know what to do when these things happen po within the workplace. No? And ideally, there's also pre-coordination already with the LGU, especially regarding contact tracing, testing, and isolation kung kakailanganin ng workplace. No, para kung meron nga po tayong makita in our workplace, it will be an easy referral mechanism to the local governments and to the hospitals who will be taking care of the patient and who will be doing these contact tracing activities. So of course, as mentioned, the vaccination is an important part of our strategy, and we should also do our part in encouraging our employees to get vaccinated. And in providing them po, no, all of the up-to-date and the accurate information about COVID-19 transmission and our strategies. So yun lang po, this is just a reminder to everyone of all of the things that we should be doing because as mentioned by all of our speakers, it is with the implementation of all of this that we will be able to combat the COVID-19 together. Thank you po.
Thank you po, Doc Nika, at maraming salamat din po to all of our speakers for sharing and sharing your time with us today. And I agree with all of our research speakers. No, while we have these initiatives, our Safety Seal program, and our partnerships with all of the regions, as well as the local government units and establishments, it is very much important pa rin to highlight the PDITR strategies as well as the minimum public health standards on top of the vaccination, so we can have this good layers of protection against the COVID-19. So now we'll be opening the floor naman po to media questions. A few ground rules for the media. No, let's try to limit our questions to 2 questions. And if there's any clarificatory questions, we can have another round for that. So let's start with Red Mendoza.
Hi po, good morning po, Yusek Boy, Ms. Asset Tess and Doc Nika. Yusek Boy, ask ko lang po for the DTI lang po. You said nga po na parang 5,000 na po yata, 5,000 po yung nag-apply and around 4,000 po. Meron po ba mga ilang private firms na medyo apprehensive pa rin mag-apply ng safety seal? Kasi, I don't know, kasi, well, the safety seal kasi is one of the, parang isa siya sa parang ginagawang, I don't know, parang requirement, quote-unquote, kahit na hindi na po siya state as requirement, na pag kunyari nag-GCQ na po, pwedeng dumagdag ng 10% yung kanilang capacity. And meron po bang mga ganong inhibitions po ang mga nag-a-apply on your end sa DTI? Like for example, mga restaurant, mga restaurant. And corollary to that, may instances po ba na mga sinihan din po ba magkakaroon din po ba ng safety seal certification?
Yusek, you're on mute po.
Yun ang pinakasikat na word you're on mute. Hindi ko nakikita yung red, hindi ko nakikita yung inhibition na elemento for business owner to not to apply for safety seal. Baka kung minsan lang, baka hindi nila masyadong nakikita yung value. Pero alam mo, dito sa Metro Manila, doon sa mga pinupuntahan ng mga tao, particularly mall, parang malaganap yung safety seal sa mga nakikita ko. Hindi ko alam kung ano yung reason talaga for the inhibition kung meron man. Pero parang siguro hindi more of inhibition but rather dahil voluntary nga siya, dahil kahit wala ka namang safety seal, pwede ka namang mag-operate, baka yun ang isa pang dahilan, yun ang dahilan kung bakit hindi sila kumukuha ng safety seal. Yun siguro. Ano yung pangalawang tanong mo, Rad?
Yung sa sinihan po, may chance po ba
Yes, of course. Lahat po na yan ay covered ng safety seal. Lahat po ay mako-cover. Ang problema nga lang, yung mga sinihan sa Metro Manila ay hindi pa po sila allowed mag-operate. Pero kasama po sila sa program ng safety seal. Kasi can you imagine kung kayo ay merong safety seal, kung kayo sinihan, it's really a confidence building pag meron kayong signage na nagsasabing safety dito.
Okay po. And last question po to USEC, to ASEC test po. I noticed po na 25 companies na po sa NCR nag-apply ng safety seal for their workplaces. Bakit po parang konti po yata na nag-apply po? And upon checking po sa website ng BWS, only a few media companies have applied for safety seal dito sa NCR. Medyo ano po ba, medyo nahihirapan, especially po media establishments are very much in the red zone lagi pagdating sa pandemic. So bakit po parang ang konti yata na nag-apply for safety seal, especially po sa mga media establishments dito sa NCR? Yun lang po. Salamat po.
Ganito, yung mga checklist kasi namin medyo iba sa as regulatory agencies. Ang DOLE kasi ang aming checklist is the usual checklist that we have been using with the DTI on really ensuring that companies are very compliant, and this is also to the DOH standards. And it's not a hesitancy, I won't call it a hesitancy, but there are so much details, and we are ensuring that the companies really comply. Kasi meron yun, the COVID prevention program, these should be in place, and they are details. And pero ang nangyayari, even if we do not have that much of the application, because DOLE continues with our inspection, and this is really the mandate of the DOLE. Pag nakakita kami naman ng establishment na fully compliant, pero hindi pa nag-apply ng safety seal, we already tell them, oy, mag-apply kasi voluntary, di ba? Mag-apply kayo kasi compliant na kayo. Sometimes kasi the awareness and the value, they don't feel it, but when we explain it further, then they start applying. Now, yung media, it's voluntary, but there is also, of course, the checklist that we're using together with the DTI, the DOH, and DOLE, which is still very extensive and which really calls for regular inspection. We maybe that might be one of the reasons, but we still tell them, and that's why it's very good for those that have applied, na they are really looking at the safety seal as an important indicator that they are compliant, and that when they do all the production shoots, when they are following, there will be no violation for all of these the minimum public health standards, as well as other standards that are required from them. So we will always encourage, pero alam mo, sa totoo din lang po, pag nakakita kami ng inspection o may mga complaints na nag-arise from the, we look at it also, but then once they start complying, we encourage. So yun ang we will continue to encourage them, but really our checklist is a little bit more extensive than the others, because DOLE po medyo madetalye ho din kami sa mga kailangan gawin ng mga kumpanya para makuha ang safety seal.
Okay po, salamat po.
Thank you po, USEC Vismonte and ASEC Tess. Let's have the question of Jerome Morales.
Hi, good morning po. Good morning, Doc Nika, USEC Boy, and ASEC Tess. Hope you're all doing well. We understand po this safety seal is an effort to boost consumer confidence, to allow firms to return to pre-pandemic levels and even position them to surpass those levels before the pandemic. But just for context po, how much have the businesses sunk because of this pandemic? Specifically, I'd like to ask how many MSMEs, SMEs have closed permanently, and what types po ito ng mga businesses, and how many jobs were impacted by this closure? So we just know how to gaano kalaki yung babawiin natin with this safety seal efforts and all other efforts by the government. Thank you so much po.
Pwedeng mauna ako. Sumagot. Anyway, DTI conducts regular survey, and through the help, nandito po si Director Tris Abejo, who is, sila po yung nagko-conduct ng survey, among MSMEs. So, meron po tayong data. Hindi po namin nakikita na it's a permanent closure. So, nakikita po natin maybe tumigil po sila either because one, hindi po sila allowed mag-open. Dahil alam naman po natin na pag sinabing ECQ, ay marami pong establishment na hindi talaga napapayagang magbukas, even MECQ. So, pero meron po tayong nakita sa survey natin na 7.4 percentage points was reported in the number of enterprises that have stopped operation from 17.4. Ito po recently coming from 17.4 from April 12 to May 14 for areas under MECQ, to 10% for the period 15 May onwards when quarantine was relaxed to GCQ. So ibig sabihin na umunti na po yung number of establishment na nagsara, nagbukas, in other words, nagbukas na po sila. So yun po yung ano natin. Meron po talagang percentage na na talagang nakikita po natin na hindi pa po talaga sila nagbubukas. In areas outside NCR plus, yung pong under GCQ or MGCQ, MSMEs that have stopped or closed operation decreased by 0.1% from 2.9% from 12 April to May to 2.8% nung pong May 15 onwards. So, ganyan lang po. 2.8% po yung sarado in NCR, yung outside NCR plus. At doon naman sa NCR plus area, 10% na lang po yung yung sarado po ngayong kasi karamihan po dito ay ECQ or MECQ or GCQ heightened restriction.
Yeah, thank you, sir. Very interesting yung mga minention mo po na mga percentage points and in the survey. But in terms of absolute numbers, Yusek, like ilan itong naapektuhan na jobs, ilan itong naapektuhan na companies po in this percentages?
Yung mga nagko-compute po tayo, for example, jobs, we gave a report that from ECQ to MECQ, di ba nag-ECQ po tayo, Tama, nung panahon ng last week, August 20 to 21, nag-MECQ na tayo. Ang tansya po ng DTI, meron pong naka-recover na mga around 1 million workers, meaning nakabalik sa trabaho. So ibig sabihin niyan na medyo lumiit na po yung numero ng mga workers na nananatiling hindi nakakapagtrabaho. Dahil alam naman po natin na marami pa ring mga establishments ang hindi napapayagan under MECQ. So, pero ang magandang balita po niyan, meron po tayong tansya na around 1 million workers ang nakabalik because of the relaxation from ECQ to MECQ. Yung ibang numbers po ay nagko-compute pa po tayo on gaano karami talaga yung hindi pa po nakakabalik, but kung lumabas lang po yung computation na to, we will report to you.
Thank you, Yusek. Keep safe po.
Thank you, Jerome, and thank you po, Yusek Vismonte. For the next question, let's have Greg Gregorio.
Good morning po. My first question would be po amid the evidence po of community transmission of the Delta variant in NCR region 4, authorities authorities are saying na wag muna lumabas kung di naman kailangan. But on the other hand, we're also saying we have these establishments naman po na may safety seal for you to go to. So how do we weigh this messaging po sa ating public?
Sabihin lang po niyan no, kung wala po tayong mahalagang lakad sa ating mga vicinity, sa community, ay manatili na lang po tayo sa bahay. So pero kung kayo po ay magtatrabaho o kaya meron kayong kailangang i-avail or i-procure na essential services or product, ay hindi po natin kayo pinipigilan. So yan po yung parang really balancing act natin para naman po meron talagang pumunta do sa mga establishment natin, lalo na po yung mga na mahalagang bagay, ay talagang meron pa rin pong bumibili at meron pa rin pumupunta. Alalahanin po natin yung talagang sa panahon na ito, yung importansya po ng lakad natin. As much as possible manatili po tayo sa bahay kung wala po talaga tayong mahalagang gagawin sa labas. At kung maiiwasan po talaga at kailangan nyo pa rin namang ng mga kailangan nyo talagang lumabas, lalabas tayo. Pero alalahanin din natin na meron po tayo ngayong mga e-commerce, mga deliveries, na kung halimbawang talagang mahalaga po yung bibili nyo, pero kayo po'y natatakot lumabas, ay meron naman po talaga tayong mga delivery services na allowed po sila 24 hours. In other words, yan po ay pwedeng para na rin maingatan yung pong ating mga population. Yung mobility po natin, nalilimit po natin doon sa mga taong talagang mahalagang nasa labas ng bahay. Ito po yung mga delivery services na sumikat po ngayong panahon ng pandemic through e-commerce. Siguro po si Dr. Nika madadagdagan yung aking kasagutan. Ngingiti-ngiti po si Dr. Nika. I'm sure meron po.
Yeah.
As a test, of course.
Opo, hindi, siguro I'll add lang po na really we're at a world right now wherein buhay na po natin itong minimum public health standards. And actually, the first aspect of minimum public health standards is elimination, or parang kung hindi naman kailangan, hindi natin gawin. So I think that's, I don't think we should take that as conflicting. If anything, it's it's additive, or it's parang different layers of protection. The first layer is if it's not necessary, we don't go out. But the second layer is if we do go out, then we have all of these things that can help us together. So I think that's also something na kailangan din natin ma-communicate and also ma-internalize, na this pandemic, this global pandemic is the situation of everyone, and we all have to adjust to make sure that we can still carry out our lives as safely as possible. Thank you po.
Thank you po.
Can I add?
Yes po, Asek. Yes po, Asek.
Kasi nandun nga nasabi mo nga na building the consumer confidence, but then we also allow, and we have to allow workers to go back to work, especially those that are doing essential services, and those that also have to go out because they are they're procuring goods and essential goods. So the safety seal kasi, like for establishments, like for the DOLE, ang tanong nga sa amin ng mga workers, talaga bang gumagana yan? Tapos what we say is that with the safety seal, because they're compliant, and like we said, especially for the DOLE, where extensive talaga yung aming checklist, we are looking at a risk that has really, we will bring down the risk for na hindi sila ma-infect, and we're reducing people who possibly could be infected and they can go to work. They can continue working because that area, that workplace that has the safety seal is compliant. They've met the minimum public health standards plus. So we are reducing that risk for them in terms of the risk of transmission, being infected from COVID. The ventilation standards are also followed. And that is the messaging we want. And for workplaces also, we have two important messages for workplaces. And this is also anchored on the PDITR. Avoid unsafe act, avoid unsafe conditions, which when you use the PDITR, you are looking at kung walang mask, walang face shield, unsafe act yan, di ba? So ano yung safe? Mag-safe, mag-mask ka, mag-face shield. Kung hindi ka mag-ano ng physical distancing, unsafe act din yan. At saka yung condition may also be unsafe. So what is safe? Do the physical distancing. And then the ventilation. That is, if it is enclosed and does not have the proper the air chain or the necessary components to assure good ventilation, then it is unsafe. So what is safe? And just putting that in mindsets of our workers, of the workplaces, we hope, we are using simple tools so that we are bringing down the message that this is now part of our lives, and we have to follow it to ensure that we are all protected. And so yun po.
Thank you po, Sec. My last question po would be for Dr. Nika How. Doc, saan po nakikita ngayon? I know you have mentioned earlier na nakikita yung mga transmission sa mga social gatherings, but we identified specific places or industry where we are seeing the transmission? Sa households pa rin po ba, sa community level, or in commercial establishments?
Thank you, Greg. Yeah. So, as being shared by our epidemiology bureau, they look at all of the submitted reports of places of exposure based on the submissions to the DOH. And based on this, actually, ang makikita mo, it's really a lot of household level transmission. And then actually looking into deeper, it's also the social situation. So even though kunyari ilalagay nila na workplace, establishments, etc., it's the act of those social gatherings that are being flagged to be the cause. No? So kunyari even in the workplace, although it's also in the list, pag nag-i-investigate, the reason for workplace transmission is because people eat together. No? Even so kunyari if they tag some discussions also in communities or in households, it's because of that exposure. Kaya po, when we do our discussions or our messaging, the focus is really on these social situations kasi intuitively, it also makes sense. No? It's in these situations na binababa yung mask, naghaharap yung mga tao, and it's also these situations na we put our guards down. So this is also something that we're determining with our communications group how to explain better. No, now we have to be safe in these kinds of social situations kasi these are the situations that are most risky for transmission and for exposure. But siguro in a later time, our Epi Bureau can show this information, but the data submitted also reflect na yun po yung mga nakikitang cause. Thank you.
All right. Thank you po, Doc. Thank you po, Yusek. Thank you, Asek. Thank you, Ms. Farina.
Thank you po to all our resource speakers. For the next question, let's have Kat Domingo.
Good morning, sir and ma'ams. My questions are for Yusek Vismonte. Sir, first, ano po yung usual reason why companies or establishments fail to get the safety seal? Yusek, I'm sorry, nakamute po.
Hindi ko talagang sabihin mo yan. Anyway, Miss Kat, I think ang karamihan po nung meron kami, for example, DTI, meron kaming denied na 1,055. Pero I think karamihan nung denial namin are one, ay hindi siya under DTI jurisdiction. So ibig sabihin po niyan, yung nag-apply ay possibly dapat ay under the LGU kasi karamihan kasi ay LGU talaga, no. So itong mga denied namin ay actually referred to LGU. Kung meron man pong denial ay siguro for the meantime. Kasi halimbawa meron silang kakulangan, hindi naman siya tipong permanently or forever ay denied. So sasabihin namin sa kanila, i-correct nyo tong mga to and then babalikan namin kayo. So pag na-correct nila, then we issue the safety seal. So ganun lang, Miss Kat.
Sir, wala naman yung kunyari, mas nahihirapan sila mag-comply with the more expensive requirements, like for example, adequate ventilation wherein they need to retrofit some stores?
Wala naman. Kasi alam mo yung requirements sa ventilation, kung ikaw naman talagang pwede naman na magkaroon ng natural ventilation, allowed naman yan eh. Yung mga medyo mahihirap talaga na ventilation requirement, yan yung talagang medyo aircon, etc. No, so meron namang engineering engineering requirement that most likely nagko-comply kung malalaki yung establishment o kaya nasa manufacturing. That's why sila ASEC test, very specific sila dyan, lalo na yung mga manufacturing kasi ito yung talagang medyo kailangan at merong requirement for yung mga ventilation requirement. Yung mga HEPA, ano ba yan? ASEC test. So,
HEPA filter.
HEPA filter. So, yun pong mga yun ay kailangan po dun sa mga ganun. Pero kung halimbawang tayo naman ay nasa mga maliliit na establishment, merong natural ventilation o kaya yung simple lang na ventilation, ay madali naman po yung matugunan ng mga establishment natin.
Okay, my last question for all the resource persons po, are there talks with the threat of Delta variant, are there talks to make the safety seal mandatory for all establishments? If not, sirs and ma'ams, prompt the government to make it mandatory.
Alam mo, hindi namin gagawing mandatory ang safety seal kasi ibig sabihin yan, mararagdagan pa ulit yung mga hindi magbubukas sa mga establishment. Ayaw naman natin yun. Yun ng mga ECQ, MECQ, napipigilan na yung pagbubukas nila eh. So kung dadagdagan pa po natin ng mandatory requirement ng safety seal, ay lalong mahihirapan na po ang ating mga negosyo. Ang mahalaga po talaga ngayon, sa tulong po ng media, ipalaganap po natin yung PDITR at yung pagpabaksinate. Napakahalaga po nito not only for as a message to each individual but to the community. Mahalaga po talaga itong prevent, detect, isolate, treat, and reintegrate plus the vaccination para na akong taga DOH. Pero yan po talaga yung napakahalagang mensahe para sa lahat. Lalong-lalo na po yung kung lalabas man po tayo, iwasan po talaga natin yung crowded areas. Kasi pumunta na po tayo ron sa mga lugar na kukunti lamang ang mga tao. At sa tulong po ng media, sana ma-highlight, maipakilala po natin itong mga concept na ito. Marami pong salamat. Maybe si ASEC Tess and Dr. Nika meron silang inputs dito.
Okay, pag nga nasabi ni Yusek Boy, mahirap nga gawing mandatory yan dahil but you know, just to stress, also emphasize the point that there is inspection still being done by the DOLE as part of our regular inspections. Of course, we cannot cover all. That's why sa safety seal, yung where consumer confidence is really needed and where there would be establishments that will be where you are going to have consumers entering, at least yon yung talagang you're telling the consumers, you're telling the public, we are compliant with the necessary protocols. And that is why that is the value of the safety seal. But for the other establishments where inspection, there is still the DOLE, but we also have our priorities. We do not have a big number but we are doing this to help them still comply. And for the DOLE naman kasi, this is part of our mandates that we are continuing to doing even with COVID. Yun po.
Maraming salamat po, ASEC.
Pwede ba ako magdagdag pa lang?
Yes po. Yes po.
Ko lang, alam mo, namutan ko tuloy. Of course, mahalaga po sa atin yung sa publiko, yung yung sandali I lost it.
Sige, we'll move on po muna to the next question.
The contact tracing for everyone. So mahalaga po talaga sa lahat na sa mga establishment po natin, sa mga tao po, sumunod po tayo kung nagre-require po sila ng mga pagpasok nyo, humingi po sila ng inyong mga apps na sumunod lang po tayo. Mahalaga po talaga yan sa ating mga pagpatupad ng ating mga minimum health protocol. At finally, ito po pala yung aking sasabihin. Ang DTI po, DOLE, at kung lahat ng mga, meron po kaming mga contact numbers. 4 na numero lang po yan. Sa DTI po, 1384. Ang mahalaga pong mensahe rito, yun pong citizen participation para po i-police ito pong pagsunod po sa minimum health protocol. Kasi sa tulong po ng citizens ay matutulungan po yung kakulangan po ng tao nang nag-i-implement, nagpag-inspect. So, sa tulong po ng ninyo, ng mga media, sa tulong po ng publiko, mai-report po sana yung mga hindi tumutupad, hindi po sumusunod through the numbers that we have provided. Meron po kami mga numerong ganyan. Sa DTI po, again, it's 1384. Thank you po.
Thank you po, Yusek. For the next question, Patricia Denise Chu, this is for Doc Nika po. What is the DOH doing to promote better ventilation in workplaces and establishments?
Thank you, Ferina. So, I think yung isang important to note here, na to begin with naman, we've already highlighted the value of ventilation. So, even DOLE has released its guidelines, regulations, I believe, March of this year. It's always been part of rules that has been recommended for implementation. But I do agree now we have to highlight the need for ventilation improvement at this time. So, yung isang example are the interim recommendations to recommend medical grade masks for those at higher risk for exposure. So even in our living CPG, which is our expert na nagre-review ng evidence-based guidelines, they noted that it will have protective benefit for those that are at risk of high exposure. And kasama din po dito na we've recommended to the group to formally review some of the tools that are being recommended to measure ventilation. So ito pong carbon monoxide monitors, yung mga internet calculators of ventilation. So at this point, really, it's something that needs to be reiterated and that will cut across all sectors and all establishments. We all know that the least risk if things are done outdoors or if things are done in areas wherein there is proper ventilation. And we know that improving ventilation may need investments. And this is really the time for everyone to seriously consider all of the investments necessary to improve ventilation, because highlighting and ventilation as part of our minimum public health standards will really be helping us in safely opening the economy. So I hope that clarifies that. Thank you.
Thank you po, Doc Nika. Asek Tess or Yusek Boy, if there's anything that we want to add to that po.
Sige, ako na, yung ventilation standards, but always remember, if you have windows and doors, open it. Again, that's the first. Because, every time they ask us, may aircon pero kung may windows and door, open it, because that air change is so important. Intandaan ho ninyo, it's that airborne. If you open your window, there's additional air that's coming. It will dilute, it will also bring out whatever is inside. At kasi na-dilute na rin yan at of course concentrations that are so low already, but open it. Then second, if it is impossible to open like this air conditioned and there, kasi it has been asked of us, paano yung mga ibang manufacturing na wala ngang bintana, but dahil because of the products that have to be manufactured, then we also put in the guidelines what should be done so that there should be fresh air supply. There is also filters that is part of their air handling unit. Yan ang sinasabi din kanina ni Dr. Nika, retrofit, because it is essential. We have to purify that air to ensure that the transmission or the risk of transmission is also lowered. Yan lang po.
Thank you po, ASEC. For the next question po from Jomer Apresto, if may bayad ba ang safety seal certificate? Kung sakali magkano po at ilang days po ba tatagal bago maibigay ang safety seal? Salamat po. Maybe we can have Yusek Boy po or ASEC Tess.
Libre po ang safety seal, walang bayad. Yun naman pong siguro mga 3 to 5 days. But of course, depende ron sa scheduling ng inspection. Kasi nga po, ang problema natin, yung dami ng tao na available to conduct the inspection. Ito po kasi ay hindi naman talaga regular nating trabaho, no? Dahil ito ay sa panahon lang ng pandemic. Pero nakikita naman po natin the rate we're going, hindi naman po nagtatagal yung pag-apply nila. Hindi po ganun katagal ang paghihintay nila bago sila ma-inspect at ma-issuehan ng safety seal. Ito po ay ginagawa natin online lang po, hindi nila kailangan mag-submit sa atin physically, nag-a-apply sila through email. Meron po tayong mga microsite, nag-a-apply sila dito sa ating through email. And then ang mangyayari lang po, ang talagang merong physical intervention o yung face-to-face ay yung magko-conduct na po ng inspection. Pinag-aaralan na rin po namin kung paano magko-conduct ng virtual inspection. Pero ito po, it will require some cameras, etc. para magawa po natin. Kasi nga po, ayaw rin naman natin na magkaroon ng face-to-face bilang pag-iingat po sa ating sitwasyon ngayon ng COVID-19 pandemic. Yun lang po.
Thank you po, Yusek. For the next question, let's have Sheila Crisostomo.
Hello, good morning po. For ASEC Cueco and Director How, mataas po ba yung yung transmission ng COVID sa workplace? And if yes, may breakdown po ba or and may clustering po ba ngayon sa mga workplaces? Thank you.
Sa DOLE po, we do have an online report system from establishments if they have COVID cases. But of course, this is just a sum, and yes, there are still reports. We receive them po, and kasi numbers na lang po ito eh. And ang alam naman ho namin, the full details after these workers have been tested are also with the DOH. But knowing that we have these reports, we also send that to our regional offices so that they can also verify. Kasi may mga requirements din ang mga responsibilities ng safety officers. Natitingnan ulit nila bakit nangyari yon, ano yung lapse, ano nangyari. So on the clustering, that one I have to look at really, but we do, if there's kasi 2 cases or more, it's already a cluster, we still see them naman po, but again we go back and right away to the regional offices and tell them to look at these workplaces so that they can be assisted in terms of ensuring that all the protocols are again in place and walang ibang issues na kailangan din nilang tignan. Because we also saw early in this pandemic na yung yung boarding houses ng mga, although not anymore in workplaces kasi yung mga boarding house ng mga workers, doon din nagkakaroon ng hawaan. And this again had to be addressed in the work by the workplace also, but mainly I mean in terms of kasi iba-iba na tong mga workplaces na yan. So these are just examples po, but we from our end we do receive, but do we receive it as much as we want? That remains a question kasi I think the latest tally that we have for 2021, you know how high the cases are, but I think we have received less than 10,000. But at that one, I need to check, less than 10,000 cases of the COVID in the different establishments.
Thank you po, Asset.
May follow-up po. Ma'am, mayroon po bang like parang jobs or industry na high risk for COVID regardless if they are complying with the infrastructure requirements like yung ventilation? Meron bang ganun na study or observation? Thank you po.
Doctor, can I kasi Dr. Nika, off the top of my head, yung healthcare. Yung hospital po, workplace yun, napakataas talaga, alam naman natin yan. But if we talk of the other, like manufacturing, construction, where we see cases na talagang nag-cluster, those are those where that we have also like construction, diba? Then we would see, because of complaints, and this is not also although anecdotal na po talaga din ito, because of the complaints we receive, BPOs. In terms of other, hindi kasi ganon kadami ang complaints, but those that we have received and that were the construction, BPOs. I'm trying to recall po because these are really coming from complaints that we received even from workers and from our COVID year.
Thank you, Asik. For the next question, let's have Aiko, but can we limit our question na lang to one? I apologize, pero kasi medyo overtime na tayo. Thank you.
Okay po, Ms. Farina. I'll address my question to Dr. Nika Hao po. Doc, based on the number of infections, more are recorded nga daw po sa workplace. What arrangements have you recommended establishments so workers will not gather to eat in one place? Kasi yun nga po, most infections come from when they eat together. Aside from not allowing them to eat in pantries, meron po bang arrangements po na they could eat pero hindi po sabay-sabay and not in a place where they can gather na dikit-dikit po sila?
Yeah. Sige. Yeah. So I think i-qualify ko lang na actually most of our transmissions is still community or household based. But it's true, we have been receiving more of workplace related transmission, and upon further investigation, it's really because of the social gatherings or meal times. So some of the instructions and some of the advice that we've been giving institutions and even some of the local government units to implement, and even po yung mga DTI and DOLE, is alternative ways of having these social situations. So yung isa talaga is meal time. So alternative ways for meal time include packed lunches or having meals in desks, or having scheduled time for people to enter pantries. But that's only the mealtime related interventions, kasi everything else across the PDITR will add to the ways to transmit. So for example, making sure the pantry is well ventilated, opening the windows, having dividers. So really, it's a combination of all of these work. Pero another social gathering that happens kasi in workplaces are meetings, conferences, or unscheduled visitors. And these are also some recommendations that we make in terms of how to implement it in the workplace. So for example, also doing those same things for meetings, either no meeting or scheduled meetings, or limiting a number of participants in a room, and of course making sure that that room is well ventilated. Similarly, yung either hindi pagtanggap ng visitor, limiting visitors, or scheduling visitors, and those kinds of things. So we do receive a lot of requests for technical assistance, and usually we give those kinds of advice later on. But often what we also tell these institutions is that who will know best will be the human resource persons of the specific institutions, and they just have to stick to the principles. The principles of having this distance, having appropriate ventilation, limiting exposure as possible, and they can make creative mechanisms within their institutions to implement this. So I hope that helps for your question. Thank you.
Maraming
Ito
salamat
po,
po.
Doc Nika. Thank you.
I apologize to our media partners, but we have to cut short our discussion. But again, maraming salamat po to our resource speakers. Thank you po for sharing your time with us and for providing updates with regard to the Safety Seal program. To formally close this Kapihan session, may we ask for a short closing message to our research speakers? Perhaps we can start with Yusek Vismonte.
I just want to say salamat po sa ating mga kasama rito sa partner agencies and those who have who joined us this morning. Sana po matulungan niyo po kami sa pagpapalaganap po ng mga information related po sa ating PDITR strategies, pagpapalaganap po ng safety seal sa bawat community. At ano pa ba? Yun lang siguro. Doon po sa ating para lang po karagdagan lang po yung po mga establishment na willing na interesadong mag-apply, they can visit our microsite dti.gov.ph at safety seal para po malaman nyo yung mga requirement at malaman nyo rin po kung ano yung mga establishment that fall under DTI at alin naman po yung sa ibang ahensya. Magandang umaga po sa ating lahat.
Thank you po, Yusek Boy. Asek Tess po.
Tulad ho ng sinabi namin, paulit-ulit namin sabihin, ang the best way to really win the battle against COVID are the strategies that are present now. We have done us to one of the biggest game changers, but we always have with us the minimum public health standards, and we continue to build on that. And when we have additional information, we also look into that to provide the necessary information so that we protect ourselves. At the end of the day, we really have to be responsible for all our actions. Everything in all the matters, from our following protocols, doing the vaccination, because at the end of the day, even mas gastos na to, pero no one is safe until everyone is safe. Yan po.
Thank you very much, Boy Asek. Doc Nika.
Sige. So I echo Yusek, Boy, and Asik Tess, no? So thank you for helping us disseminate the information that will be necessary for everyone to know how to act, no? So as noted kanina, to really make sure we get through this pandemic, we need everyone po to help out, no? So there are roles of the government, but there are also roles of employees. There are roles of families. And our strategies for prevent, detect, isolate, treat, and reintegrate will cut across all of these settings. And if I could have a final plea po, is we are very much aware that the transmission actually really happens at home and at communities. And lahat po ng pinagsasabi natin in the workplace, we should also actually be implementing in our own homes, no? So, and that's something na siguro kailangan natin to figure out how to explain better both the DOH and our media partners, so that really all of the population will know what are the appropriate things that they have to be doing to also help po, no, as a country, make sure we get through the pandemic po together. So thank you to everyone for joining us today.
Maraming salamat po, Doc Nika How, as well as Yusek Vismonte and Asek Tess. Maraming salamat po sa pagpapaunlak ng aming imbitasyon ngayon at sa pag-share po ng time and updates with regard to our initiatives. With that, thank you for to our media partners, and good morning to us.
Salamat po.
Maraming salamat sa inyo. Our